Hi guys. Today, what we're gonna do today is discussing about heart rate. So let's begin. First is why it's important to know one's own heart rate. So your pulse is one of the many tools to formulate a complete picture of your health. Many athletes track their heart rates during workouts to monitor their fitness levels and how hard they need to push. So, but staying on top of that, even that number, even when you're not breaking a sweat, can have some benefits. According to the American Heart Association, knowledge about your heart rate can help you spot developing health problems. Typically, your maximum heart rate can help you. Ano, your maximum heart rate when active is about 220 minus your age. And a resting heart rate between 60 and 100 beats per minute BPM is considered normal, but the number can vary based on your activity level, the air pressure, stress levels, body size, and even what medications you take. The more you exercise, the lower your resting heart rate tends to be. Active people often have lower heart rates because their heart muscle is in better condition and doesn't need to work as hard to maintain a steady beat. So, using your fingers, locate or find the different body parts where we can detect our heart rate and explain each pulse. So, the two of the most common areas to locate a pulse are the side of your neck, the side here, and your wrist. So, the first is the wrist. Hold your hand out with your palm facing upward, that, and your elbow relax. You just your elbow is just relax and bend. Using your other hand, put your first and the middle fingers. So this is the first finger and the middle finger, and on the side of your wrist, slightly under the base of your thumb. So the pulse is in here. This is the what you call that, base of your thumb, this one, and your pulse is in here. So second is the neck. The neck is with your first and the middle finger. So again, this is the first finger and the middle finger. So gently press side of your neck in the hollow area next to the Adam's apple in the windpipe. So this is the Adam's apple, and here's the what you call it, hollow area. So the pulse is in here. So which is where your carotid artery is. If your age is 65 or older, use caution to not apply too much pressure to the carotid artery, as it can make you feel lightheaded. So the general I will tell you the general instructions for taking your pulse. So before that, to get an accurate pulse, take your pulse the same times each other day, and sit down and rest several minutes before taking your pulse. Count your pulse for a full 60 seconds unless told otherwise by your healthcare provider. So taking your radical pulse is first with your palm up, look at the area between your wrist bone and the tendon on the thumb side of your wrist. Your radical pulse can be taken or either wrist. So, number 2, use the tip of the index and the third fingers of your other hand to feel the pulse in your radical artery between your wrist bone and the tendon on the thumb side of your wrist. 3. Apply just enough pressure so you can feel each beat. Do not push too hard for you will obstruct the blood flow. 4. Watch the second hand of your watch or a clock as you count how many times you feel your pulse. And 5, lastly, record your pulse rate. So I will let you see the picture of to get your pulse, your radical pulse in your wrist. So here's the picture. So taking your carotid pulse is the first. Find the area on one side of your neck near your windpipe. So this steps is getting the pulse in your neck. So your carotid pulse can be taken on either side of your neck. So as I said, is the hollow area beside of your Adam's apple. So this is the Adam's apple. So the pulse is in here. That. Second, put the tip of your index and your long finger in the groove of your neck along your windpipe to feel the pulse in your carotid artery. Do not press on your carotid artery on both sides of your neck at the same time. This may cause you feel lightheaded or dizzy or possibly faint. So number 3, apply just enough blood pressure so you can feel each beat. Do not push too hard or you will obstruct the blood flow. 4. Watch the second hand of your clock or a clock as you count how many times you feel your pulse. So you need a clock to count the how many times your pulse you feel your pulse. And 5, lastly, record your pulse rate. So I will let you see the picture. This is the picture. So number 3, mention and explain at least 10 factors that can affect our heart rate. So first is emotion and anxiety can raise your heart rate. Unlike an automobile that is purely mechanical, we are not slowly governed by working parts. Some days you can feel your way to the higher HR. 2. Body temperature. If you become too hot or too cold, your body sends a thermal stress load. Blood is sent to your skin to enhance heat dissipation, to cool you or increase blood flow to warm you. Apparent temperature, which account for humidity or wind chill, above 70 degrees Fahrenheit and below 35 degrees Fahrenheit, will increase your heart rate at least 2 to 4 beats per minute. Over 90% humidity can equal as much as a 10 beats increase in heart rate. 3. The terrain. Walk or run uphill and your HR increases. Walk or run downhill and your HR decreases. 4. Walking or running with the wind at your back is easy. Therefore, HR decreases. Walking or running into the wind is more difficult, so HR increases. 5. Dehydration. As you become increasingly dehydrated during a long walk, hike, or run, your blood becomes thicker and waste products build up in bloodstream. Your heart will work harder to maintain constant cardiac output. A fluid loss of 3% of body weight increases pulse rate because of decreases in circulating blood volume. 6. Diminishing glycogen stores. Your muscle primarily fuel source. As the fuel depletes, in order to maintain the same walking or running pace, your HR rises. 7. Deficient nutrient. HR increases. 8. Insufficient sleep. HR increases. 9. Insufficient recovery after a long hike, run, or other workout. HR increases, so the HR increases. Recent illness or a signal of impending illness. What is the difference between an athlete heart rate from a normal person heart rate? So an athlete resting heart rate can be considered low when compared to the general population. A young healthy athlete may have a heart rate of 30 to 40 BPM. That's likely because exercise strengthens the heart muscle. It allows it to pump a greater amount of blood with each heartbeat. So that's all for today, and have a nice day to all. Thank you.